everybody. Thanks for joining us again. Up next, we've got Urban Smedeby. He's part of the investment committee with MJIC Inc. And he's going to be with Daniel Yazbeck, CEO of MyDx Inc. And we're going to discuss IPO structures and exchanges, and then we're going to roll right into the MyDx pitch. So take it away.
All right, so my name is Urban Smedeby with MJIC, and I'm part of the investment committee. I have about 25 years of investment banking and corporate finance background, managed 3 different strategies, and I'm going to introduce Daniel Yazbeck of MyDx. And MyDx is part of the MJIC portfolio as one of our first investments. We're going to go through how he became a public company, how he raised money as a private company, and how he transitioned to be a public company, and then we'll do some Q&A. So with that, Daniel Yazbeck.
Thank you. Thank you. First slide. So MyDx, it's a science and technology company. We're on the OTCQB exchange under ticker symbol MyDx. I'm going to take you through the evolution of this company from a crowdfunding campaign in January of last year to a publicly traded company in about 2 years. Next. So the challenge today is there's no quick and easy, affordable way to test the safety and composition of what we eat, drink, and inhale. So the solution that we've brought to the table is a company called CDX. Again, it's a science and technology company founded in 2013, headquartered in San Diego, California. And these slides are on our website under ir.cdxlife.com, so you can get all these slides whenever you like. Our mission is to empower consumers to trust and verify what we put into our minds and bodies. Our first device is MyDx, or also known as MyDiagnostic. It's the first handheld chemical analyzer for consumers, and there's a picture of it on the right, and you can go to our booth and take a look at it, the latest generation. So it offers a quick, easy, affordable way for consumers to test the safety and composition of what they eat, drink, and inhale, and we'll get into the different verticals that we're approaching with MyDx. We've raised $7.6 million in private equity from January of last year until February of 2015 when we closed our Series B. We did a seed round, which was funded by my group in Yazbeck Investments, and then we did a Series A, followed by a Series B. Series A was mainly from ArcView and investors from conferences like this, and then Series B went to Paulson Investment Bank, and they took on our major Series B round. They did a bridge of $2 million and followed by another $4 million, close to $4 million. So we closed out that round, and we merged to become a publicly traded company through a reverse merger, and now we're in and then we uplisted to the OTCQB exchange. So let me go back here. So once we raised our money, and we'll go through some of the details, but we developed and tested 220 beta units in February of 2015. We shipped out these units to consumers, and we'll get into the product, obviously. So it's a complicated product. We've tried to dumb it down as in 3 easy steps, in terms of connect, sample, measure. There's been a lot that had to be done to take a lab and make it something simple that consumers can use. So we completed the reverse merger again in May 2015. We uplisted. We released the general product in July of 2015 and became a revenue-generating company. We were named in August of 2015 the marijuana analyzer of the cannabis community by Massroots, who's done a great job on in everything they're doing. I think Isaac is a great leader for his company, and we're excited to work with them. And MyDx will report its first revenue-generating financials in the history of the company on February 15th, 2015, if our accountants and auditors don't file an extension for 4 days until we get it done. So please bear with us just in case, but go ahead. So it's our simple and first mover advantage. Again, the device, you connect your device with your smartphone app via Bluetooth. You put a sample in the sample chamber, and then you push measure. And what it does is it's going to analyze what's in the sample chamber, and it's going to break down the chemical profile of what's in that sample based on our technology and our algorithms and our data, which we're going to talk about in this presentation. So we provide a diagnostic or a testing device at a price point that others can't match, and that's why we can get to the consumer. So part of the exercise that we've been going through is taking this very big lab-based equipment, which is technology that analyzes things in chemicals, right? And then we had to miniaturize it and then drive down the cost to a BOM, bill of materials, that's affordable enough so we can make a margin, supply distribution channels, and develop a profitable business. So, and really, consumers are increasingly interested in mindful in what they put in their minds and bodies. So there's a lot of things we don't know, and one of the things we'd like to know is what we're putting in our body and mind at all times. And part of the purpose of this device is to test the chemicals and empower the individual consumer at the point of care to test what they're putting in their body before they put it in their body, and then determine whether they want to put it in their body versus use their body as a test subject. So next slide. So the solution, again, it's an analyzer, and it comes in a box. When you buy a MyDx unit, you get a box that looks like this. You've got an analyzer that's inside, and in the analyzer, you have other components. So we have the analyzer that tests everything, different sensors you can use as interchangeable sensors inside the unit, and we can show you that when you go to the booth. We have a sensor inserts, which are sample inserts where you put the sample inside and you've got to dispose of these once you've actually used them. We've got a free app. It's a tracking journal really that helps you find a strain that works for you. So you test, you see how this made you feel, you start storing that data, and then you're able to mine your own database to try to figure out what's working and what's not based on its chemical profile. So we have an app that tracks what's working for you and what's not working for you, for your ailments or for what feelings you're trying to achieve. And then we have a cloud database, which is becoming very powerful in terms of, we've got almost 1,000 units in the field. They're generating data by folks who are tracking in a HIPAA-compliant fashion. They're saying, here's the chemical profile of what I just put into my body, and here's how it made me feel, or this is the ailment that it helped me relieve. And we tie that data together so that we can create a powerful database of true chemical profile backed by feeling, which you can use to possibly formulate product based on the statistics we're going to achieve with the data. So let's keep going. Our technology is interesting. It's electronic nose technology. So I come from I started my career at Pfizer Pharmaceuticals, developing drugs for them and finding alternative ways to make pharmaceutical intermediates using enzymes and greener processes. Then I went to Panasonic, and at Panasonic I joined their diagnostics and point-of-care division, where we tried to help them find new technologies in the medical industry where we can take this technology we have at Panasonic and provide it to support that industry. So I came across this technology during that time, and it's an electronic nose. So we've taken the way that we sense in nature, and it's a concept called biomimicry. So we mimic nature's designs in engineering so we can develop better products. So the way your nose works is you smell something, and then your sensors in your nose take that signal and then convert it to an electrical response which your brain recognizes, and then you interpret that signal based on some recall. So your mother told you this smells like strawberries, you're going to recall later on that this smells like strawberries. So this is the same way we take a pump, like you're sniffing, we take a sensor that has an array of sensors in it, and then we've got an app or some computerized system that analyzes the data and creates an algorithm. And so that's the technology we have. It was used on the NASA Space Shuttle to detect air quality for astronauts. It was funded by the Bill and Melinda Gates Foundation to detect tuberculosis in your breath, and it's in clinical studies in the field there. U.S. Department of Homeland Security used it for funding certain applications that they're looking for, and we've really licensed this technology from established players for our applications. Next slide, please. So these are the applications. So OrganaDX is going to test for the most common pesticides linked to cancer. So recently, the WHO released a report in March that glyphosate, thiazinon, and malathion are three main pesticides, and glyphosate is found in Roundup. So imagine the WHO reporting that Roundup causes cancer, which is essentially what they've done. But there's no way to detect whether glyphosate is present by the average consumer. We have to depend on other agencies and other processes, and we want to put that power in the consumer's hands. So I want to be able to tell you whether your spinach has glyphosate in it. And that's what we're trying to do with this device, with the OrganaSensor. And eventually, maybe you don't have to buy organic. Maybe the other stuff is just as good, and we can use this sensor and this application to help people decide, do I need to pay 15% more for the organic, or can I just get the non-organic? So this is the type of applications we're going to be pursuing with this, and it's a big market, obviously. I don't have to go into that. Next slide. AquaDX tests the quality of your water, look for certain chemicals. So we look for chemicals. So as long as we program our sensors to say, look for THC, CBD, these other chemicals, or this pesticide, we can roll out applications with the same hardware, the same software, different sensor, and different data and algorithms that we use to leverage how we do those applications. So water quality we'll be looking at. Next slide. Air quality, the Air Quality Index is a commonly monitored index by the EPA. Next slide, please. And CanaDx, which is obviously our first sensor and first application, that's the only thing you get when you get MyDx today. You get the CanaDx sensor and the CanaDx application. So we want to help people find a strain that works for them. So it tests for the 25 most important chemicals of interest in cannabis, including 3 cannabinoids and 22 terpenes. The federal government hasn't mandated medical testing yet, and we're working with a variety of labs here to really try to systemize and bring, you test across different labs, you're going to get different results. We want to bring it all together. We want to we want to work with everybody. We are a first primary screen for folks. The secondary screening can come in a more sophisticated fashion from the labs. We give you a total chemical profile, ask you how it made you feel. We give you a breakdown of what we believe is in it, and you can save that data and mine your own database to find a strain that works for you. That's the heart and soul of what we're trying to do, and support people across the industry to do that. And we're working with labs to do that. Chemical composition lab measurement is rarely consistent. And this is true, but it's improving, obviously. But we've seen that. We work with some labs who look at other labs' data, and they say, well, that number is not right. Why? Well, they told me they're ISO certified, so how can it not be right? So it's very interesting how working in an unregulated environment makes it difficult for us, because we're only as accurate as our reference database. So projected markets are increasing, obviously, in the space. And not only the folks who want a device, I mean, in certain areas, you don't even have access to lab testing. So this provides a solution for folks in areas globally who don't have access. So again, that's the CanaDx solution. That's the device. That's the app. It communicates via Bluetooth. And we report on these terpenes and cannabinoids in the bottom right, as you can see. Next slide. And we're saying it's not about THC, so it's interesting. So we service 4 markets: the growers, the distributors, dispensaries, the consumer, and then the regulators. We've got about 7 regulators who bought our device. The growers, it's interesting that they make more money when the THC level is above 20%. So between 20 to 25%, you make a specific amount. 15 to 20%, you make another amount. And it's interesting how that came about. But what we believe is it's not about THC, it's about TCP, total chemical profile. There's 400 plus different chemicals. There's actually close to 700 chemicals in cannabis, and we don't know if we've identified everything so far. They all work together in an entourage effect to impact how cannabis affects your body. And it's not about THC, even though it's the most psychoactive component. It's about total chemical profile, including CBD and all the other terpenes that modulate the effect of these THCs and CBDs and other cannabinoids in our body. Next slide, please. So our functional areas: we analyze strains, we capture your experience, we help you seek a recommendation based on your experience, and then we can give you more information, such as where to get it at a local dispensary, and information such as that. Go ahead. So we do have HIPAA compliant data, means the user's data is anonymous. We do not, we keep that confidential. It's in our software. We generate unique IDs for folks, because unless we get a HIPAA compliant form from a patient that says, please release my data or analyze my data or release it to my doctor, we can't do that. Now we'll have processes that does that in the future, but at this time, our data is HIPAA compliant and it's kept confidential until the patient provides us with that permission. So again, you scan a sample, you correlate it with feeling, you use the recommendation engine to then find those feelings and recall what works for you. And actually now when you put a sample in the sample chamber, we predict the feeling you're going to have from the sample you just put in there based on your previously tested experience. Because we've scanned things you liked, we've scanned things you don't like that you said you liked or you didn't like, and now you can put a sample and it should be able to predict for you how it should make you feel, and you can adjust those feelings to hone in and make sure that your device works for you. So manufacturers, distributors, consumers, regulators, let's keep going. Business model, we are a manufacturer of electronic equipment that generates it at a cost of goods that will add a margin to distributors, and they provide it to the retailers. So we have web sales as one of our first. Online sales is the primary channel we've generated revenues from to date. We are now deploying into distribution channels that are actively picking up, and we have folks like Christopher Andrioli, who's in the crowd, is helping us lead that effort. So if you're interested, please feel free to speak with him. And we've got obviously the wholesale channels, and then shows and and other places, and PR has been very friendly to us. So we've generated across the board. Dispensaries also, we're working with dispensaries at this time. We're going to test every dispensary's inventory. We're going to go and we're going to have folks in the field taking these devices and testing dispensary inventory so we can help patients find a strain near them that has the same chemical profile they just scanned. Not based on its name, Blue Dream, because we all know not all Blue Dreams are the same. So this is exactly why this device, once integrated across the ecosystem, will have a great impact for everybody. Growth strategy. Oh, that's all. So let's just let's go through product. Okay, so we've got a lot of other products in the pipeline. You know, we just got it. We just have to execute on our existing plan, and I think we'll all be just fine. So I don't. Our growth is based on growth capital for marketing, sales channels, distribution, and making sure we keep up with cash flow, meaning we're able to buy product and sell product and generate a profit and remain profitable and in business long enough so we can get our valuations. IP protection. We have our own IP that we've generated that couples with the IP that was the foundational IP from electronic noses. We have licensed IP. So this technology is, I think, the most mature, based on all our research and my research at Panasonic. This technology is the most mature electronic nose technology that I've come across that's been commercialized, and it's that's robust enough so it works in the field with a consumer's hands. So this is why we license this technology. We have over 30 issued patents covering all aspects of commercialization. We've got trade secrets that make sure that even though China is going to copy the electronics of this in 6 months, the sensor and the formulations that we use of how you bind certain chemicals, that's going to take them about 3 years to copy. So this is for now, and then they got to go through our patents after that. Let's keep going. So just as a summary, 2013 we established proof of concept. 2014 we developed the product. We went through Series A, and these details are on our website and how we closed, in which $600,000 initially, then $2 million, and then $4.8 million in Series B. In 2015 we released the product, and Organa is the most exciting. That's coming up right now. So we're going to complete Organa development, which is our next sensor, and that's going to test for pesticides, and that's going to be very exciting for us. In 2016, we focus on international market expansion, spin out some of these verticals possibly. For people who want to acquire Canna, we can focus on Organa Aqua Aero. There's a lot of things that we can do, but right now we're focused on the cannabis market and making sure we have a very strong footprint in that market. Next. The team, we have a great team. Jody Dillon is actually in the crowd. She's over there in black, and she runs our operations, makes sure this thing hums like it should. On the product side, I lead that effort with Rob Viegel. SY came on our hardware. Rob is on software. Travis Laughlin, application development. And our partners, such as AQS, it's a 10,000 per month facility in Fremont, California, that manufactures these at scale, and they can scale to China from there if we need to. Next Dimension Technologies provides our sensors, and they work with us on that front. On the finance side, Paulson Investment, some other IR folks. We work with MJIC Media to support on some of the sponsored content, and we're also working with CFN and the IR. It's interesting. We were working with MZ Group, but we're thinly traded as an OTCQB company. One of the goals we have right now is to make sure we increase that exposure on the public markets and possibly uplist. We'll see what we're going to do, but the bottom line is we need to improve in that front. On the revenue side, again, Christopher Angioli, who's now taking care of a lot of the sales, business development, customer service, and really beefing up that process so we can scale. Garrett does customer service. We have social media. We have online channels. And our legal team, Wilson Cincini, one of the top in the country. We've got Steve Davis locally, a little more affordable than Wilson Cincini, so we can leverage him in San Diego. Natco, and a lot of other folks. Advisory board that's very strong as well. Let's keep going. So that's it. Our takeaways: we have a first mover advantage. We're at a price point nobody else can compete with at this time. Patented and licensed technology, aggressively pursuing other markets, and the database of feeling and chemical profile can be leveraged to create, thin film strips at some point, some formulated product for for MyDx or for cannabis, and an experienced management team, and we'd like to support the industry by helping legalize it with data that we're generating and converting all this anecdotal data into scientific data or semi-scientific data until we get this FDA approved through a process. So thank you very much for your attention, and I'll open it up for any questions. Yes? CBN. Every 6 months you'll get a new sensor, but we're going to come out with a loyalty program or like a MyDx Care, like Apple Care. In a way, we'll replace your sensor anytime it goes bad, and we'll just be able to charge a specific fee, so you never have to worry about that. And we typically have that type of cut. We're a startup. We just came out. If you have a problem, you send it to us. We'll take care of it. There's never going to be an issue. Yes? So there's a lot of things that go into the feeling, and it's very specific to the individual. I like tequila, you might like vodka, right? It's the same thing. The cannabis, Blue Dream, and OG18 will have different chemical profiles. So depending on your endocannabinoid system and what's happening in your own body, you might need certain chemicals more than other chemicals, or I don't like the word chemicals because it sounds so bad when cannabis and cannabinoids and terpenes are good for you, anecdotally at least, and we're proving in other ways, as well as other people, that it's arguably good for you. So the question is, how do you quantify a feeling? It's very specific. That's why in your app, you're going to say, this made me feel this way. And MyDx will remember that this total chemical profile made you feel this way. So next time you scan a sample, it's going to recognize the chemical profile, and it's going to say, well, let's look at what the nearest chemical profile is in his database that says it made him feel, and then it's going to predict a feeling based on that. So we're recalling a feeling based on a chemical profile, but not all Blue Dreams are the same. So don't focus on the name, and that's been the biggest issue. It's the only way to do it right now is focus on the name, because it's too complicated otherwise. Even if I give you can take 5 samples that have the exact same THC to even CBD ratio, and you'll get a completely different feeling, because you've got terpenes and you've got all these other chemicals in there. So it's very specific to the individual. MyDx, my diagnostics help me track and quantify what's working for me and then recall that. So you just have to try and save, and then it will predict and become smarter at predicting for you based on what you've saved as your data. So that's the principle. So I don't know if that addressed your question, but did you get his question? Yeah. Yeah. Well, it's ailment relief and feeling. So when we report, we tell you, you can start tracking anxiety or even, epilepsy symptoms like seizures. Let's get off the feelings one for a minute. Feelings we called side effects at one point because Apple wouldn't approve our app because it wasn't recreational. So Apple said, you can't track feelings, you can only track ailments. So we started tracking, and so we had to call feelings side effects. Like I relieve my epilepsy symptoms, but I feel lazy, right? So that whole science we had to go through, but it depends on how you felt before. Depending on what you put into your body at that time in terms of the chemical profile, it will impact your feelings, and there's environmental factors. It's very complicated, it's subjective. That's why we try to make it easy. Do you feel happy or sad? Do you feel lazy or energetic? Do you feel distracted or focused? So we try to ask you the right questions to try to get you to answer, because if you ask, how do you feel? It's a complicated question to ask people. I feel good, I feel bad, I feel, so we're trying to get to the science of that in an easy enough way. I'm not sure if I answered your question, but we'll talk about it offline. Organa Aquanero. Maybe. The answer is maybe. But I don't know until they do. So, Chris, what do you think? Are the sales of Canna going to fund the... So we'll see how we do on the sales side. In the meantime, we're not stopping to raise money. We actually have an active $2 million round right now, which Paulson Investment is supporting us with, just to make sure we have a buffer to expand the other verticals. And if you're interested in participating, let me know, or Jody or Chris, and we'll help you. Please.
As a consumer, when you say test the samples, are you only testing the
Flour.
Yeah, okay, so is there an opportunity?
So we have so we do have other. We are looking at. And I've mentioned this publicly already. So we are looking at residual solvents in extracts. So that's the first pass at safety. It's actually fairly easy for these sensors to do that. So residual solvents in extracts, and one pesticide that's kind of come out before the full organosensor. We're calling it maybe the Canna Plus. We'll see what it. But we have those sensors. We're validating, and we want to see what happens there. So so we are looking at residual solvents for flour, and if we populate our database with enough concentrates, which we seem to have enough of, it's over 50% of the market in California. I'm not sure about other areas, but then we can provide the content for the concentrates as well. But I do want to shift to safety as soon as possible. I think the total Canna profile is interesting. We'll continue to build on that, but people want to know, I don't want to be smoking a pesticide, period. You know, it goes through the lungs. It's very harmful. It's not. So that's still our focus, and we're trying to accelerate that, as well as, you know, pesticides is a major issue, and we want to go after that market. And yeah. Oh. Okay, let's go to have a drink.